This semester, I've spent my time here at Longwood assigned to the women's basketball team for my clinical rotation. I know the sport pretty well, and I knew that there was going to be various different injuries throughout the season, but I didn't know exactly what injuries to expect. It is no secret that there are a lot of injuries in basketball, and this is due to the intensity of the game itself and because of the long seasons, especially in the collegiate setting. Going into this season, I noticed that there were multiple athletes who suffered from the same injury, and that injury didn't seem too common for the sport of basketball to my knowledge. I noticed that they were suffering from shoulder subluxations. So, a shoulder subluxation is a partial or incomplete dislocation that typically occurs from variances in the structural and functional integrity of the glenohumeral joint in the shoulder. The head of the humerus slips or moves out of the glenoid cavity in the glenohumeral joint and then returns to the original location in the joint. The structures that are typically injured from a shoulder subluxation are the labrum and the rotator cuff. The most common direction of this instability is anteriorly. Coulivardi et al. Conducted a study on 4,080 subjects. Out of these 4,080 subjects, 1,960 of these players had a shoulder instability event, and out of those players, 884 were classified as shoulder subluxations. In the study, they found that football players had the highest injury rate, which was 0.40 injuries per 1,000 athletic exposures. Generally, more athletes sustained an injury during a game or a competitive setting compared to the practice setting. Females were also more likely to sustain an injury due to contact with an object. So there are various ways to prevent this injury. It is important to know that muscle laxity surrounding the glenohumeral joint is a crucial factor in the joint stability itself. The most common preventative measures for shoulder instability include bracing and various instability tapings that either use kinesio tape, Leukotape, or elasticon. Overall, shoulder strengthening exercises such as the Blackburn exercises are the best way to prevent any shoulder-related injury or prevent incidents. Likewise, instability braces are indeed the best option for post-injury because of the longevity of the product and its consistent prevention and cost effectiveness over time. There are various different ways to treat a shoulder injury. In this case, there is a lot of controversy in the medical field on what is the best option for treatment of shoulder injuries, such as shoulder subluxations. The main argument that I have seen in the literature is between conservative rehabilitation, which includes strengthening exercises, such as I said before, and various forms of rehabilitation, including modalities. The other option is a surgical option to fix the affected structures from the shoulder instability incident. Many studies demonstrated the effects of non-surgical conservative treatment versus this surgical intervention treatment. Jacobson et al. Conducted a study where one control group was given the surgical intervention and one group was taken through the conservative rehabilitative exercises previously stated. In Jacobson et al.'s study, in the two control groups, there were patients that had chronic instability that ranged from general shoulder instability to shoulder subluxations to shoulder dislocations. Overall from the study, the conservative treatment group had a satisfaction score of only 26% after the 8-year follow-up. The primary repair surgical group had a satisfaction score of about 72% after the 8-year follow-up. Ultimately, the literature says that in the active population, it is best to consider a primary repair surgical treatment to help reduce the patient's risk of recurrence after shoulder instability. It is also concluded that the conservative rehabilitative exercises are more beneficial to the patient after the primary repair surgery has been completed. Lastly, it is important to know that this injury is not isolated to the world of athletics, but it is a serious injury that can affect the everyday person, such as you and I. Thank you for your time.